So, welcome back, everybody, to the monthly AVH webinars that are just now starting, but will be going every month from here until November. I hope everybody is well and safe, and I'm sorry that we're starting a few minutes late. We have a great talk for you tonight with Dr. Tim Fior. He's going to share the work that Andre Sain's Materia Medica Pura group has been doing. And tonight the remedy that he's going to teach is Hecla. Dr. Fior is a 1985 grad of MSU, MD grad, and certified in family practice, and has been practicing exclusively homeopathy and family medicine, and is a really nice guy and good friend. So Tim, take it away, because I know you got a lot of stuff to share. Oh, and there's a handout for tonight. If you guys open the handouts tab in your control panel.
Thank you, Jeff. Can you see my screen and also the webcam?
Yeah. Yep. Looks
okay,
great.
Good. So thank you, Jeff, for that kind introduction. As Jeff said, there is a handout. Basically, I have another version of the handout. I've given you kind of the essential stuff in the handout. I've got a few more things on what I'm going to go over, but I tried to gear it a little more toward veterinary medicine. I'd like to kind of talk a little bit about myself too, to let you know how I got into homeopathy. So as Jeff said, I trained at Michigan State University, did medical school there, College of Human Medicine. They call it the College of Human Medicine because there's a veterinary college there, as I'm sure many of you know, and also an osteopathic college. So I did a family practice residency in Michigan as well, associated with Michigan State in Saginaw, Michigan. And that was really when I started practicing there and as a resident and prescribing drugs, it really kind of struck me that, you know, medicines were dangerous. I mean, some people got really sick. Sometimes they got helped. Sometimes didn't do much. Sometimes they got really sick. Sometimes people died after taking medicines. And it really kind of blew my mind. I thought, you know, I'm pretty smart. Why can't I make this be a little safer? And luckily, I had the opportunity to travel to Chicago, and I met my mentor, Dr. Joel Shepard, and he introduced me to homeopathy. And I said, hey, give these little sugar pills. I don't know that it works, but at least it seems a lot safer. And then I started taking some remedies myself. One remedy was silica for, I had low energy, I had spots on my nails, I had kind of really stinky sweat. And silica, when I took silica, just my confidence boosted, my energy was great. And eventually the stinky sweat went away, and I was like, whoa, this is amazing. This stuff actually works. Silica is actually related to the remedy we're doing today, Hecla. Hecla, like silica, has offensive sweat, and it has issues with the nails as well. So this monograph is actually written through the Materia Medica Pura project. I'm going to tell you a little bit about that. I've been studying with Dr. Andre Sain for many years. And he reached a point where he said, really, I don't have anything more to teach you guys, but we could do Materia Medica, because after Herring created Herring's Guiding Symptoms, no one really updated the Materia Medica after that. There were just things published in different journals. And basically what Herring did is he looked at the world's literature at the time and included everything, the provings and clinical symptoms from cases all in one spot. And that was Guiding Symptoms. But since he did that, really the Materia Medica has not been updated. So the Materia Medica project was started in like early 2000s as an attempt to update the Materia Medica with smaller remedies, like for example Hecla. And we started with, you know, more common remedies, sepia and related remedies and such, calibic. And then Dr. Sain's son actually developed a very rare form of ALL, acute lymphocytic leukemia, which was very aggressive. And he was treated allopathically, and Andre treated him homeopathically. And I think that started Andre's interest in cancer. And so we started really looking at smaller remedies, or seemingly smaller remedies, that were useful for cancer. He did a very complete monograph on conium, and then a monograph on remedies like Hecla, which we think of historically as useful just for teeth, but actually it's a very good cancer remedy, very good for osteosarcoma, bone cancers. Veterinarians have used it for such, and regular medical doctors have used it for such. So let's dive into the monograph. Hecla lava, it can be spelled several ways. It's C-L-A, C-K-L-A, or K-L-A. Hecla lava. Remedies that are related, calc fluor, we'll see in spinal stenosis, fluoric acid, of course, calc phos. Solanum melanoxylon is a very good remedy for like shoulder or other ligamentous tendons that are calcified. It has a very narrow range of action on that. It's close to remedies like conium. It has a temperament of Staphysagria and a little bit like sepia because it likes continued motion and it likes sun. So it's made from the fine ash particles from eruptions of Mount Hekla, which is the most famous volcano in Iceland. And on average, it's erupted about 30 times since it was first erupted in the 11th century, about 3 times a century. The longer it goes, if it goes about 100 years or more between eruptions, then the eruption is much bigger. If it's shorter time, then it's less of an eruption. The last eruption was in 2010. In Icelandic, the word Hekla means hooded cloak, and you can see here's a picture of Mount Hekla. You can see the cloud cover, kind of gives you an idea of like a hood. It was first mentioned in the homeopathic literature in the British Journal of Homeopathy in 1846. And what happened was what they found was after an eruption, any animals feeding on the fine ash, right after the eruption, oftentimes animals would die. But as time went on, animals that survived would develop exostoses on the jaw and on the limbs. And this was after the 1845 eruption. And here's a quote. They said, on the bones of the feet, they were formed in less than 24 hours, so very rapidly. And it's interesting because this remedy also, oftentimes when it has an effect, it works very rapidly. Osseous excrescences of an oblong form, which gradually assumes so formidable a development they prevent the beast from walking. Also manifests in lower jaw and extends in all directions so considerably that it splits in several places. So Garth Wilkinson, he was a homeopathic physician who was of Danish origin. He went to Iceland and he wrote a letter to his colleague, William Holcomb, in, I believe, New Orleans. And he also sent him some of the Hekla lava ash in a 30C potency. At the June 1870 meeting of the AVH, Dr. Holcomb read Wilkinson's letter and talked about his own experience. Wilkinson reported that Hekla lava had constituents including silica, alumina, lime, magnesium, some oxide of iron. Now it's interesting, Wilkinson would have got his ash when he went was like 20 some years after an eruption. Now, one of the main constituents of the ash at first is fluoric acid or fluorine. When the volcano erupts, the fluorine is released as a gas and it attaches more to the smaller particles, which then fall a little further away. And the animals that eat it, of course, get very sick and get these exostoses. Some of them die from acute fluoride poisoning. But the fluorine is water soluble. So very quickly, within a few months, the fluoride is washed out. So he got it some 20 years after the eruption. Now, in the future, if anyone, any of the pharmacies get Hekla lava ash to make remedy, they should probably do it soon after an eruption. It'd probably be a lot more potent in terms of the fluorine content. And it's not obvious whether Wilkinson observed animals or humans made sick. It was more he heard reports, more from reports of an eruption, because he's, again, 23 years after the effects had died down. After the 1947 eruption, the first eruption over 100 years, so that was a long time, the People reported lesions in animals as after previous eruptions, irregular nodules covering the legs and lower legs of sheep, and lameness with difficulty walking associated with the bones of the legs being extremely tender to touch. You'll see when we get to the cases, we have a few cases of splints in horses, which are on the fore or hind limbs, on the inner surfaces. I believe they're like little extrusions, which can be hard, which can be associated with fracture, etc. And actually, Heklava has been shown to cure those splints in horses. And then scientists became aware that these effects were principally due to fluorine poisoning, as they saw similar lesions in animals that drank water with fluoride. So he collected his ash 23 years after the last eruption. So that was probably most of the fluoride had been gone. But because he did find these exostoses and it did help exostosis, probably there was still some fluoride left. These are a couple, I think I left these on your handout. You can click on these links, and they are pictures of the older eruption and then 2010 eruption. This shows you the amount of fluoride in parts per million. See, here it goes up to 4,500 parts per million of fluoride days after the eruption. And you see within a month, it's gone from like 4,500 to less than 300 within like a month. So very quickly the fluoride leaves the ash, but then it gets into the water supply, and this also poisons the animals. Here you can see the distribution of the ash. The size of the ash, the biggest is here, and then progressively, as you go out to like the purple here, this is where the finest ash is. You'll see some of these eruptions are quite destructive and actually kill a lot of animals, and sometimes I think one of the eruptions killed maybe half the people on Iceland. So the jaw lesions came first, and only in advanced cases did the nodules appear on the legs. But the mandible tends to have the highest concentration, as if fluorine accumulates in bones with the highest tension, where the highest tension is exerted. Some deformities of the molars were observed, irregular growth of the molars, some of them in sharp points. And in the MMPP repertory, we have teeth, pointed molars like needles. Heklava's the only remedy there. It's a 3. So after the 1945-46 eruption, which was a big eruption, there was an incredible amount of fluorosis, as it had been dormant for about 60 years. Cattle that ate it, they got really sick and died. The bones of animals were examined. Here's a bone of maybe a cow, and you can see the extensive fluorosis, all this extra bone on the this extra bony exostoses on this looks like a limb bone. And here you see the fluorosis on the teeth of, I believe this is a horse. Now, this phenomenon of acute fluorosis in animals around volcanoes is not unique to Mount Hekla. It occurs oftentimes wherever there is a volcanic activity. For example, in Japan, it's called Aso volcano disease. At Herculaneum, which was destroyed by Vesuvius in 79 AD, the remains there, they find diffuse deposits of fluoride, concentrations of in bone of 10 to 16,000 parts per million. Healthy bone has 200 to 1,000 parts per million, so huge amounts of fluoride. The dental lesions, this is back in 1694, an Icelandic farmer described from animals eating on the ash, dental lesions, stained yellow, black spots. He called it ash teeth. And here you have a color picture of the discoloration. Now we see this in humans a lot. We see because like in Illinois, I see a lot of children that have mottled teeth, kind of white, some brown, some yellow. And this is from the fluoride that they put in the water, up to 4, it's usually 1 or 2 parts per million. The problem is fluoride if it's discoloring the teeth, it's also affecting the bones. And I know I had at least one patient who was a football player who had a minor hit and became paraplegic because he had spinal cervical spinal fracture, which resulted in a spinal cord injury. And it wasn't that hard of a hit, so I think he was susceptible more because the fluoride had made the bone a little more susceptible to fracture. Here's some more pictures. I'm not sure, this might be a cow, and then this looks more like a horse, I think. And this is not from Mount Hecla, but this just shows the nodules on a cow with fluorosis. This is from industrial contamination. You see these nodules, diffuse nodules. Fluorine is actually an essential element, and it's incorporated into bones and teeth. However, too much, obviously, is not good. Grazing animals, cattle, sheep, horses can die in the first 2 weeks of an eruption due to acute fluorosis. They lose strength, they get anemic, they get fractures. It's interesting, 30 years ago when I was in family medicine starting out, we used to give sodium fluoride to women with osteoporosis, thinking, well, look, it makes the x-rays look stronger. Yeah, the x-rays look stronger, but it's mostly cortical bone, but actually they had more fractures. It was soft bone, it was brittle bone. So they stopped doing that. Plus, sodium fluoride, if you give it, it will lead to thyroid issues. In 1970, with the eruption, 3% of the sheep and almost 10% of the lambs in the ash-covered areas died from acute fluorosis. And as I mentioned, the worst episode was a Laki volcano eruption in 1783. Half the population of Iceland died, and because it was long going and a lot of fluoride. The first symptoms of acute fluorosis in livestock: they lose their appetite, they get drowsy, prostrated, lame, ataxic, bloody froth from the mouth and nose, bloody diarrhea, dyspnea, seizures, pulmonary congestion, edema and hemorrhage, kidney and liver changes, very low calcium levels, and of course a lot of fluoride in the urine. Chronic fluorosis affects the bones and the teeth, makes the bones more brittle, and you can get bone and joint deformities and these exostoses. And then, of course, the discoloration of the fluorosis. And people living in the area where ashfall is in Iceland also develop the same bone and teeth deformities like the animals. And if they're drinking the water, they can also get acute fluorosis. Excavated skeletons from the ash, from people exposed to the ash of Mount Hecla show many bone changes, signs of fluorosis, osteomalacia, rickets, ossification of ligaments, interosseous calcifications, ankylosis, a fusion of the joints, fractures, effects of the enamel, caries. Actually, fluorosis is because fluoride is found in some groundwaters, is kind of endemic in many countries, and especially where there's volcanic activity. The first signs of chronic fluorosis in cattle and sheep is they become thin and their coat becomes coarse and lifeless. And then they have trouble walking around and start limping. The most severe form is crippling skeletal fluorosis. They get bone deformities, calcification of ligaments, pain, immobility. Chronic fluorosis results in a long list of lesions: brittle bones, fractures, joint disease, osteoarthritis, periosteal exostosis, and these exostoses in spurs and joints. In fact, in humans, at least for like heel spurs, Hecla is one of the remedies you need to consider, and also for spinal stenosis. So many different kinds of bone problems, and the discoloration of the teeth. And they resemble, the lesions with chronic fluorosis resemble many other bone diseases: hyper and hypoparathyroidism, ankylosing spondylitis, Paget's disease, sarcoidosis, heavy metal toxicity, lymphoma, hypervitaminosis A and D. The bone lesions tend to be bilateral and symmetrical. The first clinical fluoride bone lesion usually seen on the ribs and mandible. And maybe a function of the amount of tension. There was a farm in Pagosa Springs, Colorado, where horses were exposed to large, high amounts of fluoride, up to 1.3 parts per million of fluoride for extended periods. And they developed symptoms of fluoride poisoning, hypothyroidism, and colic. And it's interesting, when they took the fluoride out of the water, the colic went away. It can affect fertility. After about 5 years of exposure on that farm, hoof deformities. You can see this hoof is just totally, it's like it fell apart. It's just, it's like it's soft or something. This is a 22-year-old horse that had been on fluoridated water for 21 years. As I mentioned, fluoride interferes with thyroid function. It interferes with the conversion of T4 to T3. And a Harvard School of Public Health study published in 2006 showed osteosarcoma was related to fluoride exposure in drinking water during childhood. And it's interesting, osteosarcoma is one of the bone tumors that Hecla lava is good at treating. So as a result of this monograph, the whole idea of this monograph process is we collect we get an introduction, and we collect all the characteristic symptoms from every source we can find. We collect as many cases as we can. This monograph ended up being almost 130 pages. I've given you just a small snippet of that, maybe about 30 pages, but it's most of the stuff that I'm going over. And then once you have all these symptoms, you go back to the repertory and then you make additions, because a lot of this stuff that's material that's in the Materia Medica and the different journals is not yet in the repertories. So there were only 193 entries in the complete repertory 4.5 that we use for the Materia Medica Pura project work, and 1,402 entries were made. So, 1,209 entries. So now there's 1,400 entries. So it's much easier with using this repertory. It's much easier to come to the idea of using Hecla lava, because it comes up higher in the repertorization without using a repertory that's been enhanced with these rubrics, with Hecla lava and these rubrics. It's hard to prescribe it. It was first proved, interesting enough, not until 2003 through the Bose Foundation and Mohinder Singh Juss. And the proving confirmed many known clinical symptoms and helped to shape the remedy by bringing many modalities and other characteristic symptoms, which we're going to talk about in a moment. There's many modalities, or several modalities, which you need to pay attention to. It was a double-blind, placebo-controlled proving with 30C for 6 weeks. 17 provers were given Hecla lava, 35 provers were given placebo. Every day they wrote down their symptoms using their own words, and they graded them from 1 to 5, 5 being the most intense. And then the symptoms were taken in a bold grade, a second grade, or a regular grade. The proving produced, of course, some new symptoms and verified a lot of already known symptoms. They said the Hecla lava has proved to be a syphilitic. Its effect on the bones can be destructive, slow, and deep-acting remedy, and thus presents interesting therapeutic possibilities. But it's not necessarily, it's deep-acting, but not necessarily slow-acting. It can work quite quickly. The problem with the proving was it wasn't very precise. For example, one of the symptoms, pain in the joints and small bones of the limb, especially the hands. Does this include the fingers, wrists, toes, ankles? So it could have been more precise. This is one of the things about, like, Hahnemann's proving. Say Hahnemann would, when he did a proving, people would say, I have a headache, and he'd start interrogating the person. Okay, well, tell me about your headache. Where is it? What makes it better? Does it extend anywhere? What makes it worse? He would interrogate the person to bring out symptoms. Apparently, they didn't do that so much in this proving. So what is the genius of Hecla lava? These are the symptoms that when you see in clinical practice, it would make you think, oh, is this a case of Hecla lava? And it has slowly accumulated a rich symptomatology, which comes from the toxicology, from the poisoning of the animals, and also cured cases, and now proving. It started out being used almost exclusively in cases of bone, gland, and tooth problems. And the proving confirmed many of the sensitivities and modalities. So it should become a much more, after this monograph, hopefully a much more frequently prescribed remedy. I've been using it certainly more in practice. And other remedies that are close to it would be remedies such as conium in cancer, sepia, Staph aureus because of the sensitivity, rust tox because it's worse first motion, better continued motion, worse, it's better with heat, worse with cold, and symphytum and calc fluor for conditions of bones. Now, Dr. Sain, after this, going through this monograph, he started using it, and he found several patients who responded well, one with an Ewing sarcoma, multiple myeloma, and solitary plasmacytoma. In fact, Dr. Ramakrishna, who's written a book on using homeopathy in cancer from India, he uses Hekla lava a lot in cancers of the bone. And an increase in energy is one of the first symptoms to improve in these patients. It could become a very common remedy similar to silica or calcarb. As I mentioned, it has similarities to silica in terms of the foul perspiration and also the nail changes. If you're going to prescribe it, the modality should fit. So from the beginning, its main indication was bone tumors, exostoses, especially on the jaw, but it could be elsewhere, calcifications, problems of the jaw, specific remedy in a number of important syndromes, bone and bone marrow or blood like leukemia, cancers, and found with symphytum to be one of the main remedies in cases with primary and secondary bone cancer. When you have metastases, you have to think of remedies like symphytum, Hekla lava, and especially osteosarcomas, Ewing sarcoma, multiple myeloma, and acute and chronic leukemias. Now, a local physician, a family physician here in not far from Chicago, wrote an interesting article in the National Center for Homeopathy journal, Homeopathy Today, about using, she had an epiphany that when you have spinal stenosis, it's kind of like, she did some pathology, and the bone there tends to be like softer bone that impinges on the spinal cord. When she read the proving of Hekla lava, it made her think of that. And so she started using Hekla lava in patients with spinal stenosis. And she had great results. She used like a 30C twice a day. And she found then when she added on calc fluor 6X a couple times a day, the two together did really well. So it's become almost specific with calc fluor in cases of spinal stenosis. Bone spurs, special heel spurs, as I mentioned. So jaw problems like tumors, cancer, abscesses, osteomyelitis, dental, facial, and head neuralgia. We had a practitioner in our office who had very early on had lost a upper central incisor and had she called it a flipper, like a bridge put on, and eventually she went for an implant. And after the implant surgery, she tried arnica, she tried hypericum, she tried symphytum, no difference. And finally, she tried Hekla lava, and it really helped the pain. In fact, now I routinely recommend people who are having implants and other jaw surgery to make sure they have Hekla lava on hand because it's such a useful remedy. There's a syndrome called Eagle syndrome, where there's a calcification of the styloid bone or the stylohyoid ligament, and basically people get ear, throat, jaw pain associated with movement of the head. One of the characteristic symptoms of Hekla lava is the pains tend to be very intense. They're described as violent, excruciating, agonizing, intolerable, unbearable. This is similar to symphytum, which again, for like a broken bone. And here are the modalities. The bone and joint lesions of Hekla lava tend to be worse with touch, worse with pressure, like symphytum, and worse with movement. And the swellings and tumors tend to be hard and also sensitive to touch and pressure. Because of the hardness, it can be used for bone tumors, but also for hard breast tumor. So these tumors are sensitive to touch and pressure. The pains are often of a neuralgic character. They're described as burning, shooting, sharp, stitching, lightning, striking, and they can come and go suddenly. There's also an element of rapidity. Animals who were poisoned, sometimes these lesions grew overnight. And the clinical response is usually very rapid too with Echolava lava. As I mentioned, it can affect the breast, a stitching pain in the breast, like with the breast cancer, and induration of the glands, and affections of the glands with induration. Dental and facial neuralgia with, again, carious teeth, dental abscesses, and after extraction or implant. It has ailments from injury, fall, contusion, injury to the bones, especially fractures, head injury, and extraction of the tooth. Swelling of the face from carious teeth, and after extraction or maybe an implant. The gums are swollen, kind of a bluish purple, and tender to touch. The wounds heal slowly, and it again tends to have very offensive discharges and offensive sweat, like silica. The nails are soft and brittle. I don't believe it has spotted nails, but it does have soft and brittle nails. So it looks, again, like silica. Now we can compare it. Here's a comparison to symphytum, which we know is for fractures, but can also be used back in the Civil War. They used it for gaping wounds to try and fill in the tissue. So for the chronic effects of sprains and injuries to the joints, ligaments, cartilages, you think of Ruta, symphytum equally. So we can compare Rutum, symphytum, and Hecla. So of those three, all are worse from touch and pressure and cold, and better with warmth. They're worse with first motion. But Ruta and Hecla are worse from rest, or Ruta's worse rest, especially Rustox is worse with rest, wants to move. Hecla's worse after rest. And Ruta and Hecla are better from continuous motion. Well, symphytum is usually worse motion. Maybe if it's a symphytum that's healing, it might be better from gentle motion. Ruta is the only one that has better with a continuous change of position, which is like Rustox. And Ruta and symphytum are worse lying on the affected part. Hecla and symphytum both have very severe pains, intense pain, neuralgic pain. Ruta tends to have more of a soreness, almost more like an arnica soreness. Ruta and Hecla are both sensitive to weather changes, symphytum not so much. Now, we're going to talk about the personality of symphytum of Hecla in a second. It has a personality which is very similar to Staph aureus. It has indignation, very sensitive, can throw things. Hecla and symphytum can both be used with degenerative joint disease or bones and bone cancers. But Hecla is more specific to problems of the teeth and jaws. And symphytum, of course, is more specific to like injuries, globe injuries with like a ball or something hitting the eyeball or the orbit. So the personality of Echolava, it's a very sensitive remedy. This came out from the proving. Very sensitive remedy, resembles Staph aureus, very sympathetic, easily indignant, sensitive to relationships, contradictions, criticisms, injustice. It might be good to look at the repertory. And this is the Materia Medica Pura repertory updated as of October 2020. So you see sensitive to injustice, we have Staph aureus, well, Echolava is a 2. Sympathetic. Echolava is a 3, that's similar to phosphorus. Indignation. Staph aureus, spirinum, but also Echolava is a 2. It's a very sensitive remedy, sensitive to relationships, contradictions, criticism, injustice, and the least change of routine. Can be very volatile, like fluoric acid. Can become irritable, violent, angry, abusive, and insulting. Can throw things like Staph aureus. It will suffer from ailments from anger, shock, grief, suppression, suppressed anger. gentle but stubborn and irritable. And they avoid arguments, kind of like staph aureus, because they can become explosive. They can become hysterically violent, quarrelsome, they hit or throw. So I imagine in animals, this could show as an animal that's kind of, you have to walk on eggshells around them. They can be nice, but then they can just, just freak out, become violent. Easily stressed, feel tense. Tension, they tend to hold in the nape, shoulders, cervical region, like Ignatia. They can reach a point of indifference, listlessness, lack of ambition and motivation, indolent, lethargic, sad, melancholic, depressed, despair of recovery, hopeless, helpless, apathetic, exhausted, tired, anemic. They want to be alone. They can't concentrate. They have difficult thinking, foggy, stupid feeling in the head, memory problems, especially short term. It's interesting, fluoride is again affects the thyroid, which can affect memory. Has problems finding the right words. And interestingly enough, this came out in the proving, the mental symptoms are worse when there's a change to snowy weather and better sitting in the sun. So this is where the similarity to sepia and better with motion comes from. And only in the proving there's an excessive thirst for cold water and better from cold drinks. Modalities, it's sensitive, so it has a lot of modalities. It's worse at night, worse touch and pressure, even the touch of the clothing. Worse in the morning on waking or rising, like Rustox, but not Rustox wants to change position at night, not so much with Hecla. Worse after rest, worse first motion, better with continuous motion. Change of position a bit, but not as much as Rustox. Better walking in the fresh air, sitting in the sun, and running, better running like sepia, but also better moving slowly. Worse damp, cold, and especially a change to cloudy, snowy weather. Better with warmth, sunny, sitting in the sun, better occupation. It's a big remedy for exostoses, necrosis of the bones, bone and bone cancer. This is just the Materia Medica. And comparisons, we can compare it to conium. Both remedies tend to develop indurations, hardness, similar sensitivities in justice, cloudy weather, relationships. And they both have vertigo turning in bed and more increased earwax and stitching pain in the breast. Compared to sepia, both remedies, they love exercise, sitting in the sun, and are worse cloudy, better from occupation. Staph aureus, they feel the indignation, sensitive to injustice, hold their anger in until they can't handle it anymore, and they throw things, violent. They both have trouble with the teeth and caries, suffer after tooth extraction, calc floor, bone and lymph node problems, and the spinal stenosis. Fluoric acid, both indicated in long-standing dental abscess and fistulas. Rustox, the pain and stiffness with rest, better first motion. Worse first motion, better continued motion. Worse cold, better warmth. Hecla is not as bad at rest as Rustox is. Rustox wants to keep moving, is restless at night. Hecla is not like that. It's worse after rest in the morning. We mentioned the Solanum malacoxum, calcification of ligaments and tendons close to articulations. Andre has found in some patients he's avoided surgery with large osteophytes. Didn't change with any other remedy, and it was very quickly better with the Solanum. And of course, symphytum for bone cancers and Mets. Aurum metallicum is a related remedy with the deep despair. Let's talk about a few cases. The treatment of splints in horses. 3 years ago, I bought a well-bred mare. Very prominent splint the size of a walnut on the inside of the near foreleg, 3 inches below the knee. Did not cause lameness or cause unsoundness, but wanted to remove it. Because of Garth Wilkerson's mention of Hecla lava, he tried it. He put on an ointment, interestingly enough. and also on the tongue. In 3 weeks, the splinting and softening. In 3 or 4, it had disappeared. Now, this is something that Dr. Sain is doing, and I started doing a little bit. Dr. Sain has done a lot more in patients with cancer, with metastases and stuff. Not only are you going to give a remedy by mouth, maybe a chronic remedy, maybe a remedy for the metastases like Symphytum, you're going to give it orally, but maybe also you're going to put on you're going to make a lotion with Symphytum and put it on the spot, and it seems to help even more, and does not seem to cause suppression. Here's another case with splints. Seems like the same author. In another case of splint. I'd like to go to another case from a vet. I don't know if anyone is familiar with Dr. This is case number 73. There we go. Dr. Loops. charlesloops.dvm.com, and he talks about his experience with osteosarcoma. And this is all on his website, actually. If 60% of my new cases have cancer, and most of these several hundred companions each year survive longer and have a better quality of life than cancer patients treated with Western medicine or other modalities. Having practiced 32 years as a vet, 10 with Western medicine, and over 20 with homeopathy, there's little doubt about which is the more effective system and which has the most curative approach to disease. The side effects of homeopathic treatment are improved overall health and a heightened sense of well-being. Side effects not typically found with Western medicine. Talks about the osteosarcomas. Again, this is all found on his website. Dogs with osteosarcoma respond well to homeopathic treatment. It says here, my homeopathic protocol has been refined. It has more frequent potency changes than before. These changes have improved results with a higher percentage of dogs diagnosed with osteosarcoma surviving longer on average. I think this is how it works in homeopathy. If you look at Dr. Ramakrishna's experience, if you look at Dr. Sain's experience, I can look at my own experience. And we recently, at our last meeting of the Illinois Homeopathic Medical Association in May, and also some AVH people attended as well. Dr. Todd Cooney gave a presentation on parvovirus, and it was very interesting. What happens is you first start treating a certain condition, and you refine your case management skills over time. And now I was very surprised. Dr. Cooney at first said, this is a bad disease and most vets are afraid of it. But after using nosodes and stuff and refining what he did, now he doesn't even worry about it. It's like he doesn't get cases of it. Very interesting. And I think this is what Dr. Ramakrishna found. This is what Dr. Sain found. This is what I found. The more you learn how to manage these cases, you go up in potency quickly if you have to. If it seems like a very serious case, you find remedies like Hecalava and use them if it's appropriate. More patients do better and they survive. Here's some recent cases. And in 2005, similar to Dr. Loops, another veterinary doctor reported better results with Ramakrishna's approach. And I think Dr. Sain met Dr. Loops at a conference in 2019, and Dr. Loops said, since I use an alternating protocol for my cancer patients in which the constitutional remedies alternate every other day with Hecalava, it is difficult to attribute any characteristic symptoms or confirming ones to Hecla. I have not found Hecla useful with bony tumors of the head, face, nasal cavities in dogs and cats. Now, certainly in people, nasal cavity, face, head, jaw, that's been one of the big indications. And also, like we said, spinal stenosis. It's only in osteosarcoma of the legs, front, and rear. I feel the remedy is indispensable. So that was his experience. In many other cases, these are cases of like the anger. This is an Asperger patient who had like erupting like a volcano. That makes you think of Hecalava. And many bone problems, joint problems. Here's a patient, myotonic dystrophy, multiple sites of spinal sclerosis. She tried Hecla-LAVA, she got better. She went off it, she got worse again. She went back on Hecla-LAVA, she did better again. And here we have some cases of Dr. Ramakrishna. And here's Dr. Katchen's protocol. I think this is 2013 for spinal stenosis. Her protocol is to use the Hecla-LAVA, I believe 30C twice a day, and as well as the Calc-Fluor 6X twice a day. And Ramakrishna says for bone and bone cancers, principal remedy for cancers, primary and secondary of the bone, sarcomas, osteoclastomas, myelomas, Ewing sarcomas, other bony growths, acute and chronic myelogenous leukemia. And you have to use some vitamin as well. And he has a lot of statistics. Lymphoma of the stomach, multiple myeloma. Even patients in the 90s respond very well. And I believe this is Dr. Katchen. He had a series of 9 patients, all were better with spinal stenosis. And some of the x-rays actually improved, MRIs improved. Her so she does Hecla-LAVA 30C and Calc-Fluor 6X, 4 tablets under the tongue once a day. I think that's kind of what I wanted to present. I don't know that there's other cases that are applicable so much. Here's some more of Dr. Ramakrishna's experience. The idea is he gives a chronic remedy, but first he'll give a lesional remedy because the cancer is often a dissimilar disease. So you have to treat the cancer. As that's doing better, then he'll prescribe a chronic remedy. And I know doctors who treat cancer, I just had a patient die of metastatic colon cancer. Unfortunately, didn't really call me back until he was already stage 4 and chemo had been exhausted. And he did really well emotionally. He also had prostate cancer, was getting treated for that, which probably led to some hormonal changes. He was very weepy, and he did really well with pulsatilla for that and made him feel emotionally better, but it really didn't affect the tumor and the cancer markers. So for that, you have to, if it's a dissimilar disease, you have to use other remedies if you can find them. So I think that's what I wanted to present. I can open the floor to questions if anyone has any questions. We have about 6 minutes for questions or more if you want.
Jim, that was awesome again. So thank you, thank you. How about how often do you use Hecla?
Oh, more so since reading this monograph, more so. Certainly for dental things, it's become a go-to. If someone's having an implant or something, I always tell people that make sure they have it. And I'd say 70–80% of the time the patient ends up using it and they find it very helpful. I have another patient. She's a very complicated patient. She's a patient who's seen other homeopaths, and then they come to me, and she's had thyroid cancer, and she was abused, massively abused, sexually abused as a child, and but very nice woman and very sensitive. And it's very interesting. Hecla really helped. One of the symptoms of Hecla-LAVA is the Heberden's nodes, the nodules, the arthritic nodules of the distal interphalangeal joints, and it really helped that. We were giving many other remedies, and it wasn't helping that. But the Hecla-LAVA helped that, the hand and joint pain and the nodules. It was worse on waking, and she'd take it, it'd aggravate it, and then it'd be better. And it's interesting, we don't think of a remedy like Symphydem. I also gave her Symphydem at one point, and you normally think of Symphydem as just for bones. Well, she really likes Symphytum because it helped her depression. Whenever she took it, it helped her depression better than Orum. So sometimes remedies have effects on the mental state that we aren't always aware of. So yeah, so I'm using it. I'm using it more and more. I don't see so many people with bone cancer like Andre does. He kind of specializes in that. Um, but certainly for joint things and arthritic things and spinal stenosis, I certainly have used it more.
Thank you. Any other questions from anyone? Okay. Well,
I see Judy's there. Hi, Judy. And of course, Susan.
Judy and Sue, Jody are here. Fantastic. So let's see.
Hi, Judy.
Hi, Tim.
How are you?
I'm doing good. Doing good.
Good. You use Hecla Lava much in your practice?
I've used it a couple times, mostly for bone cancer, but I like this idea of the stenosis. You know, I've had really good success with lumbar disc problems with rust tox, so I may look at Hecla Lava if the rust tox doesn't work.
Do animals get, in humans, spinal stenosis, especially lumbar, but it can be cervical too, but most often lumbar is a very common thing. Is that common in animals too?
Yeah, so it's can be breed specific, like dachshunds have a genetic predisposition for it. And a lot of people are doing agility and stuff, and they're not doing the core fitness and everything, and they just, weekend warriors with their dogs and jumping and going over and twisting and stuff, and they come up with back and shoulder issues and joint issues. So yeah, we do see it quite a bit.
I knew people could be weekend warriors. I didn't realize animals could, dogs could too. So that makes sense.
Yeah, well, with their guardians, they are. Yeah.
Interesting.
All
Well, thank you
right.
for that.
So anything else from anyone else? Sue, do you have anything you want to ask? I know you commented about Joyce and Cindy having cases in splints, but anything else?
Susan.
Yeah, it's an interesting remedy, and it's nice to see it presented in a a broader way than we've often been had the materia medica for it. So I think that's really lovely, and I think just historically that whole volcanic fluorine poisoning, I think I just go back and look at some cases over the years, that you don't think about that as potential. And I look at a case I know of an elderly person who had really serious ankylosing spondylitis when he was or spondylosis when he was a young man. And because of a bunch of reasons is not very deformed, doesn't have that ventroflexion that most people have, but also in his life with chronic tooth pain and some dentition issues and that sort of stuff, and you just wonder how that medicine might be helpful to him.
Yeah, it's interesting how remedies come into practice based on a couple things, maybe some clinical experience, and then when they're proven, more information comes out. And, we think of it as a very narrow remedy, but it actually could end up being, the more you use it, you see, wow, it has a very wide utility, but you just don't think of it. It's not in the repertory so much. The materia medica that we see is very limited. We don't necessarily, now with a monograph like this, you can see the breadth of the experience of the homeopathic community. But if you just like read Borky or something, it's just maybe a bit more limited. So yeah.
Exactly. So looking at it from this perspective, have you thinking about stepping back and thinking about some you know, because you think about it, as you said earlier, it's not a particularly well represented remedy, and you know, maybe because of that we should pay attention when it shows up. But and I also think of another case that I know of, that's a person who got his radius and ulna fractured. He had a big tree fall down on top of his tractor. And they should have had a funeral, but they didn't. And has broke the plate, had surgery, scraped out a whole bunch of exostoses, you know, between the bones in the interosseous area, and had some issues with that. And it's a really, I've got to go back and read it. He's certainly got some traumatic history of spinal stenosis and that sort of stuff, but also has got some persistent tinnitus, and have to go back and read it, and vertigo specifically as well. And also some occasional bloody discharges. It's kind of an interesting.
Interesting, yeah.
Yeah.
Oh, and just so everyone knows, the full monograph eventually will be released with MMPP to Synergy, so it will be in the Synergy, the new Synergy software, which they have a new update. And actually, excitingly, you know, I teach naturopathic students homeopathy, and for a long time they really haven't been able to have the same repertory that I have, the MMPP repertory. And now they're basically all the additions from the MMPP are going to be in, like this week, they're supposed to release a new version of the reliable repertory in the Synergy software, which has all the additions. So that repertory is getting much more similar to the MMPP repertory. So I'm excited, you know, students finally get to have the same repertory I have. So, and we can all, you know, homeopaths can kind of share. I know older homeopaths, we have access to the MMPP, but then newer homeopaths, not necessarily.
Yeah.
All right, Tim. Well, we want to respect your time, so thank you so much. Unless there are other questions, Jody, Henrietta, and Carolyn, Cindy. Nope. Francine, Ela, nope. Well, then I guess we'll wrap it up and say thank you again to you, Tim. We really appreciate your time and look forward to seeing you soon.
Yes, that would be nice.
Yeah. Well, I guess we'll skip Montreal again this year. Still haven't
Maybe
opened the
next.
borders. All right. Thank you, everyone.
All right, everyone. You take care.
Have a good night.
Have a good night. Yeah. Bye-bye.
Bye-bye.